holistic medicine used to be alternative medicine. It's kind of used to be called alternative medicine. And I trained at the Mayo Clinic in physical medicine and rehabilitation. And then I started the Park Nicollet low back clinic, sports medicine clinic, and acupuncture clinic, which was like 30 years ago. And I see Carolyn. Carolyn was, we were at the alternative medicine committee at Park Nicollet 30 years ago. She was heading it up. She's still heading it up, sort of. And Helen Healy and people, we were, yeah, there she is. So we've been doing this a while, and I think Carolyn was 15, I think. I was a little older. But physical medicine, why I'm talking about this, acupuncture is a physical modality. And I learned that physical medicine and rehabilitation was really the alternative medicine for musculoskeletal pain before there was alternative medicine. And back then, you'll hear what we've been talking about. We use electricity. We just talked the last one. Electricity, microwave, diathermy, heat, cold, massage, mobilization, exercise, that sort of thing. It's all physical medicine and energy healing, light therapy, but it's all alternative. It was alternative medicine. Now it's holistic medicine, and so we're privileged to be that. So what? And Prolozone is a natural medicine. There's a technique. It's a physical medicine technique too. What is it? Prolozone. Prolo comes from the word proliferate, and we're trying to proliferate healing in the connective tissue, in the musculoskeletal system. And it also uses ozone, which is 3 oxygen atoms. We've heard of ozone, it's this fresh smell after a lightning storm. And that's 3 oxygen atoms. And this uses solutions like B vitamin, talk about B vitamins, homeopathics, propane, and also some dextrose. These are things that stimulate connective tissue growth factors, stimulate healing. And that's what we're all excited about, right? Healing. And how it does it is it hyperoxygenates a lot of different ways. But ozone hyperoxygenates tissue. Our connective tissue is white, right? Cartilage, tendons, ligaments, they're white, right? They're white because they don't have a good blood supply. They don't heal well for the same reason. They don't have a good blood supply. And the Prolozone brings nutrients, oxygen, blood supply to the deep tissues. A lot of pain problems, you see a lot of pain problems. Pain is often poor oxygen utilization at the deep tissues. And Prolozone brings oxygen and nutrients to the deep tissues. Similar to, what does acupuncture do? Stimulates energy, stimulates healing, stimulates the body to heal itself. Energy healing, healing touch, light therapy, infrared, it's increasing energy, increasing blood flow. And oxygen is one of the most powerful energy sources in our bodies. We think of what's the most important nutrient. We think of water, that was mentioned. You can go a week without water, but you can't go 3 minutes without oxygen. Oxygen is not only necessary for healing, it's necessary for life. So this is bringing that oxygen. Ozone stimulates the immune system, it's anti-inflammatory, it's analgesic, it increases stem cell production, growth factors, and starts the healing process, or continues or jump starts the healing process. So how do we do it? How do we do it? It's an injection technique. And we talk about not all the things, because I can't cover everything, but I incorporate others in this room where we're looking at nutrition, exercise, spiritual unforgiveness. I like Dr. Katulski was mentioned. He talks about you got to remove toxins, and there's spiritual toxins too, unforgiveness and abuse and different things like that. So we try to, take in what are any barriers to healing, and then try to bring in the nutrition and the healing. How we do it specifically is different injection techniques. Subcutaneous is one. It's a very small subcutaneous injection of the solution followed with ozone gas. It puffs up the area and it stimulates a healing response in the whole body, but especially locally. I've got a few examples. One gentleman from Duluth, he came in with 20 years of chronic thoracic pain, and I used that subcutaneous technique. And in 3 or 4 visits, he was pain-free. He started telling me about his elbow and stuff. And he could golf, and it was tremendous. And he was excited. Talk about being excited. He was excited he could golf, and the other people would have those examples of those great results. But they're excited. We're excited. That's why we're here. So another subcutaneous technique is very powerful. You wouldn't think it. Oh, it's just under the skin. But one gal came to me from Michigan she was scheduled for bilateral carpal tunnel release. She's nodding her head over here. Yeah, bilateral carpal tunnel release, bilateral cubital tunnel release. She had 4 nerves were going to be operated on. She said she heard about Prolozone. She wondered if it would be helpful. I said, it sure can. It helps a lot of people. And we did that. She was gone. I saw her 3 years later for her knee. She came back and I said, what happened to your wrists and elbows? She goes, oh, I was fine. I never had the surgery.
Wow.
And that's dramatic. And then sometimes we get these dramatic results. Not always, but oftentimes it's impressive. Because we're allowing the body to heal, right? We're giving the body, what's what we all do here. We're trying to get the body to heal itself. How effective is it? I'm getting ahead of myself. That was subcutaneous. And we also do intra-articular, like knees, for instance. People with meniscal tears who don't want surgery, or their degenerating joint, they don't want it replaced. We will do intra-articular injection, and it can repair cartilage. I tell people that's not the purpose. If you get cartilage, great, but we want to decrease your pain, improve your function, and 80% of the people get help when we select them correctly. That doesn't mean 80% of them are cured with one treatment, but it means 80% will say that it's helpful, and that was helpful. So like that one gentleman, he injured his knee 6 weeks before he was going to climb Kilimanjaro, and I treated him a lot in those 6 weeks, but he climbed Kilimanjaro. He still had some knee pain, but he could do it. And so meniscal injuries, degenerative joint disease, those are intra-articular. Then we also do intramuscular injection. Probably the most common intramuscular injection would be for low back pain, or disc herniations, radiculopathy. People get disc herniation, new nerves pinched. One example is 42-year-old guy his wife was a chiropractor. He couldn't get off the couch because he had herniated a disc, and his leg pain, he couldn't stand up. And she helped him some, but she said, you need to go see Dr. Kramer. And I saw him. He's a father of 3, and they're going to Disney World in a couple of weeks. And he couldn't walk. One treatment, he's up at least walking. He's not jumping around, but he's standing up straight. After 2 treatments, he was able to go to Disney World and carry his kids around. And he was excited, talking about excited. I was excited. His wife was really excited because he said he's the pack mule when he could do his work. He needed some more treatments, but he's doing really well. So those are kind of the specific techniques. Different areas that we can treat. What does it treat? Those are kind of 20% doesn't help. Okay, nothing helps everything. But it really treats things head to toe. Really, from head to toe. I can't think of a joint I haven't injected, from a TMJ to the big toe, bunion. Any degenerative joint. See, a lot of people with degenerative joint disease want more like a shoulder. Older people with degenerative joints don't want shoulder replacement. A lot of times it's if they don't have to. It's a big procedure. It doesn't always work terrifically. But they can, after some treatments, they can drive a car where they couldn't get their arm up that far. They can get something out of the cupboard. So they're pleased with their activities of daily living. They're not throwing baseballs, but it can be helpful for those kinds of things. But from head to toe, like migraine headaches, one gal, migraine headaches and neck pain, disc herniations, degenerative disc disease. One gal, she had migraine headaches since she was 12. I treated her probably 6 or 7 times, I think, total. But she was getting narcotics. We talked about narcotics. Narcotics every month from her pain doctor. So every month, everyone has a pain doctor. And she came back and she didn't have any migraines anymore. She had occasional headaches and some neck discomfort, but nothing disabling. And she said, my pain doctor said, how can this be? That you don't need the medicines. You know, and so she was excited. I was excited. But that neck pain, headaches, migraines, shoulder, we talked about rotator cuff tears. One guy from Duluth, he was, hi. He came from Duluth, he's a house painter. And they told him he needed rotator cuff surgery. We've all heard about rotator cuff surgery, right? And he said, they said I'd be out of work for 6 months. That means I'd lose my house, I'd lose my business. I treated him 3 times and he's painting houses. And he's still painting houses. And because he sent a friend of his. And he said, yeah, he's still doing great. We talked about low back, disc herniation, degenerative disc disease, spinal stenosis can be helpful for it. Knees, shoulders, knees, and toes. So in summary, I'm excited about Prolozone because it's really the most powerful healing agent I've found for musculoskeletal pain in 34 years.
How painful are the shots?
The question is how painful. They're shots. Some are very minor. Some hurt more depending on the person. Some farmers from South Dakota said, I guess I felt it. And some other people are, sensitive. So, but it's the most powerful healing agent. And it's a holistic. We do a holistic, and we should all be, honored that we're holistic practitioners. I pray with my patients. I say God's the healer, I'm not the healer. I encourage you to offer to pray. Many of them will say the prayer was more important than the injection. And we know prayer research, it shows that it's effective. So I want us to be excited about healing, excited about being holistic medicine practitioners. And I want you to do what my 7-year-old Henry said one day. He said, Dad, have a great day helping heal your patients. Woo! So I want you guys to all have great days helping heal your patients and have great lives helping heal your patients. It's a privilege, it's a gift.